Hello everyone, this is Dr. Tom Chaney from Living Health Integrative Medicine, and in today's video I want to talk about the relationship between osteoarthritis and type 2 diabetes, even pre-diabetes, and metabolic syndrome. So I'm on this website here, this is diabetes.co.uk, and they just recently published, this was 29th of January 2024, and the title of this article is Osteoarthritis Risk Associated with Metabolic Syndrome. One of the things I hear with many of my diabetics coming in is they have achy joints. So osteoarthritis, that's the degeneration of the joint, which can break down the cartilage, and then the cartilage breaks down and it create pain. Metabolic syndrome, so you may be asking yourself, what's metabolic syndrome? So there's a couple criteria when it comes to metabolic syndrome. So there's 5 criteria, and you have to have at least 3 out of these 5 criteria to be considered to have metabolic syndrome. So abdominal obesity, increased triglycerides over 150, low HDL cholesterol less than 40, high blood pressure, and then also high fasting glucose. So if you have 3 out of those 5, then you meet the criteria for metabolic syndrome, which puts you at an increased risk for having type 2 diabetes. So that's what metabolic syndrome is. And in this article, they talk about patients, even with metabolic syndrome, have increased risk of osteoarthritis. So if you have type 2 diabetes, of course, that's going to accelerate this whole process of degeneration. One of the notes they put in this article is particularly people with elevated C-reactive proteins had this increased risk of osteoarthritis. So C-reactive protein is an inflammatory marker that I run on all my diabetics, and commonly it is high because as a diabetic there's a lot of inflammation in the body, which is one of the reasons why a diabetic doesn't heal as fast as a non-diabetic. So if you're a diabetic, or if you have any of those criteria that we talked about, and maybe you do have metabolic syndrome and you have achy joints, one of the ways that you can help your joints is to handle those issues. So that's what we help patients with, helping get inflammation down, help your body regulate your blood sugar better, lipid profile will improve, so triglycerides go down, HDLs go up, LDLs go down, and C-reactive protein will go down when you handle the right root causes. And that's really the key when it comes to metabolic syndrome and when it comes to handling type 2 diabetes. So I hope you got some good information from this video. And if you have any questions about metabolic syndrome, type 2 diabetes, osteoarthritis, go ahead and put it in the comments below, and I'd be happy to answer your questions.